Welcome. The purpose of this video is to introduce you to tracheostomy tubes and their care. At the conclusion of this video, our hope is that you will be comfortable with the terminology and parts of tracheostomy tubes. We also plan to introduce you to the different elements of caring for your tracheostomy tube. Please note that a variety of different care topics will be covered, so it is important for you to practice what you learned in this video on your own time. This video will be divided into sections. The first section will cover tracheostomy basics. Patients with breathing difficulties for a variety of reasons may require a tracheostomy. Tracheostomy involves creating a connection between the windpipe, or trachea, through which one breathes, and the neck. This communication is maintained by having a tracheostomy tube in place to prevent it from closing. Common reasons to have a tracheostomy tube are poorly functioning lungs or breathing muscles requiring assistance of a breathing machine, blockage or obstruction of the windpipe higher up, and weak cough requiring suctioning through the windpipe to prevent buildup of fluid in the lungs. After a tracheostomy is performed, the air that normally flows through the voice box and out through the mouth instead flows out through the tracheostomy tube. Because of this, patients temporarily will have no audible voice as the air does not vibrate the voice box since it's escaping through the neck. Similarly, patients cough through their tracheostomy tube instead of through the mouth. Tracheostomy tubes differ based on size and other characteristics. Most are made of plastic. When one first receives a tracheostomy tube, it often has a balloon on the end of it called a cuff. This cuff can be inflated externally through a piece called the pilot balloon with a syringe. The cuff helps prevent leakage of air for patients on the breathing machine during surgery. Some cuffs are inflated with air and others are inflated with sterile water. If you go home with a cuffed tracheostomy tube, your packaging should instruct you on what to use. Many patients transition to one without a cuff as they recover, often labeled as uncuffed or cuffless, the latter sometimes abbreviated as CFS. There are additional variations in tracheostomy tubes. Some have fenestrations or openings which allow additional air to flow through the voice box and mouth. Tracheostomy tubes vary in size based on patient size, and some non-standard varieties exist for patients with longer or thicker necks. Beyond this, custom tracheostomy tubes with different lengths and diameters can be created. Tracheostomy tubes are often secured to the neck with stitches immediately after surgery, along with a collar, referred to as a tracheostomy tie. The stitches and Velcro attach to the flat part of the tracheostomy tube that sits against the neck, known as the plate or flange. After several days, the stitches are removed and the collar alone holds the tracheostomy tube in place. This collar can be adjusted with Velcro to fit the neck. Some tracheostomy tubes have an inner tube that can be removed and cleaned and replaced. This tube is called an inner cannula. This allows for cleaning to prevent blockage without removing the whole tube. It either twists on or is snapped into place. While some patients feel that they breathe better with the inner cannula out, it is important to keep this in place, as it can be easily removed and exchanged compared to removing the whole tracheostomy tube should a blockage occur.
We recommend performing tracheostomy care with a clean technique, that is, with hand washing prior and use of gloves. The nose normally moistens or humidifies the air you breathe in. The moisture helps keep thick mucus from building up in your windpipe. With a tracheostomy, you are no longer breathing in through your nose, and instead breathing through your neck. As such, you lose the ability to moisturize the air you breathe in. It is important early on to keep the air you breathe through your tracheostomy tube moisturized. If the air is not moisturized, thick mucus can build up and dry, which can block your tracheostomy tube and make it hard to breathe. Your tracheostomy may eventually no longer require consistent humidification, but if you have thicker mucus, you will want to keep using a humidification device. In the beginning, you may require assistance to clear the mucus from your tracheostomy tube. Suction machines with flexible suction catheters are designed to do this. You should suction yourself when you hear audibly that mucus is building up in your tube, often noticed by a rattling noise. Your body will make more mucus in the beginning as it adjusts to the tube. This will improve over time. Other times to suction are before and after changing the tracheostomy tube and when letting the cuff of the tube down. Suction catheters come in different sizes. Use an appropriately sized suction catheter that your tube can accommodate. Smaller suction catheters may become blocked more easily, and you may need a bigger size for thicker mucus. You should know the length of your tracheostomy tube. It is typically listed on the packaging of your tracheostomy tube. Using this length as a guide, it can help you determine how far to advance the suction catheter into your tracheostomy tube. We generally recommend measuring out the length of the tube on the suction catheter. That way you don't suction beyond the tip of the tracheostomy tube too far. This will help prevent irritation to your windpipe. When suctioning, turn the machine on and insert the suction catheter into your tracheostomy tube without your finger covering the suction hole. When ready to suction, place a finger over the suction hole to activate it and slowly withdraw the suction catheter. For very thick secretions, you may need to utilize saline bullets. Squirting a small amount of saline into your tracheostomy tube, then immediately suctioning afterwards can help prevent buildup of dried secretions. If your tracheostomy tube has an inner cannula, it is important to keep this clean. Inner cannulas are secured into place by either a pinching motion or a twisting or rotating movement. It will usually click when it is secured. Some inner cannulas are disposable and are thrown out after each use. They are typically changed twice daily. Non-disposable inner cannulas should be cleaned twice a day. This is best done with a brush that can extend down the tube. You can use a mixture of sterile or boiled water and hydrogen peroxide mixed in equal parts.
When patients are nearing getting their tracheostomy tube out, it is capped or blocked off. While this is happening, you are breathing normally through your nose or mouth and not your tracheostomy tube. The cap varies depending on the model of the tracheostomy tube. Some models are placed on the end of the tracheostomy tube, whereas others require the whole inner cannula to be exchanged. Your physician can talk to you more about capping when you reach that point. Keeping the area around your tracheostomy site clean is important. Some patients will keep a dry, split gauze or sponge tucked underneath the tracheostomy tube flanges to keep the skin protected from secretions, although this is optional. If you choose to do this, change it whenever it becomes wet to avoid skin irritation. To clean around your stoma, take a Q-tip or cotton-tipped applicator dipped in a mixture of half sterile or boiled water and hydrogen peroxide. Work the cotton-tipped applicator around and underneath the flanges of the tracheostomy tube to clean the skin. When you perform your tracheostomy tube changes, you will be able to see the stoma prior to putting the new tube in, and this provides additional opportunity to clean the area. The ties around your neck holding your tracheostomy tube should typically be changed at least every several days. They can be changed more frequently if they become soiled. When tightening your tracheostomy ties, you typically want to be able to put 2 fingers between the tie and the skin of your neck. You may need some assistance when doing this. After tightening it, you may notice there is some excess length on the collar. This can simply be trimmed with scissors. While there usually is a larger Velcro strap to undo on the tracheostomy tie, leaving this one in place and undoing the 2 smaller ones at the front can help you keep the tie the same size for your neck. You can use the old one as a guide for the size of your new one. The Velcro can be difficult to thread through the tracheostomy flanges at the front, particularly if you have problems with dexterity. Keeping a pair of tweezers on hand can help with this.
Tracheostomy tubes in adults are often replaced once a month. Reasons to replace sooner include if it's blocked or malfunctioning, maybe the cuff has popped. You should clean your tracheostomy tube at least once a week, similarly to how the inner cannula is cleaned. While changing your tracheostomy tube can be done while sitting upright in front of a mirror, after the stoma has matured, it is often done initially while lying flat. When preparing to change it, make sure the new tracheostomy tube is ready. You will want to have the obturator, which is a curved plastic piece with a rounded tip, inside the tracheostomy tube. The obturator allows for easier insertion of the tube into the stoma as it has a narrower profile. Lubricating the tip of the tracheostomy tube can help facilitate an easy change as well. Placing both sides of the Velcro ties on the flange can make it easier to attach the ties after the change. It is important to suction your tracheostomy tube prior to changing it. When removing the tube, keep in mind that it is curved, so as you pull it out, you will have to pull it down to allow it to exit smoothly. When ready to replace the tube, it is often easiest to start with the tube at a 90-degree angle to the stoma. Place the tip of the tracheostomy tube into the stoma, then rotate your hand as you are pushing in so that the tube flanges are horizontal in line with the neck. Pushing straight in will not usually be effective as the tube is curved. Once the tube is in place, remove the obturator from the inside of the tube. With some trachs, you will have to exchange the obturator for an inner cannula, whereas other brands, the obturator is made to fit with the inner cannula in place. At this point, you can secure the tube to your neck with the Velcro tie. If you meet a lot of resistance, it's best to stop. You may need to adjust the angle or the amount of rotation. If it feels tight, you may need to put a smaller emergency backup tube in place. If you're unable to replace your tracheostomy tube, it is best to come to the emergency department for evaluation. You will still be able to breathe through your stoma even without the tracheostomy tube in place. A passemeer valve, abbreviated PMV, allows for speech with the tracheostomy tube. It is often purple. It allows you to breathe in through the tracheostomy but prevents air from coming out. This forces air to go up through the voice box, allowing for speech. If you have a lot of secretions, it can be hard to use the PMV as it can be coughed off the tube or become soiled with secretions. In that case, it is best to hold off using it until secretions decrease. Without a PMV, you will have to communicate through other means such as pen and pad, writing board, cell phone typing, or text-to-speech applications. Patients with cuffed tracheostomy tubes are generally recommended to avoid using PMV, although they can be used when the cuff is down. If the cuff is inflated with a PMV in place, it can lead to dangerous buildup of air in the lungs, and the lungs can become overstretched and develop tears in the lining. This can be life-threatening. Depending on your underlying condition, you may be able to swallow with your tracheostomy tube. It is up to your physician to determine this, along with other healthcare providers such as speech and language pathology. You may have to take a special swallowing test with X-ray to determine your ability to swallow. If you are unable to swallow with your tracheostomy tube, you may need a feeding tube to help with nutrition. Avoid getting water into your tracheostomy tube. It is okay to shower or bathe, but you may need to adjust your routine. Options include specially made shower guards, keeping a towel or bandana loosely over the tracheostomy to keep water from getting in, or keeping your back to the shower.
It is normal to have some throat irritation initially with the tracheostomy tube. This will improve with time. Some patients will have the sensation of something being stuck in their throat, but this usually improves as well. You will often feel your tracheostomy tube when you swallow. Because less air is going through your nose, patients may have a diminished sense of smell and taste with the tracheostomy tube in place.
Some patients will require home nursing care for their tracheostomy tubes. They can help with tracheostomy tube changes, suctioning, and other care. It is important to learn to care for the tracheostomy tube yourself, as home care can sometimes be limited. Become familiar with your home equipment, namely your humidification system and suction machine. You should have emergency supplies with you at all times. You should have the same size tracheostomy tube as well as an emergency backup tracheostomy tube one size smaller. You should have the appropriately sized obturator with you at all times. Having a packet of lubrication can help facilitate replacement of a tracheostomy tube. You should also keep a portable suction machine with you while out. It is important to know the brand, size, and type of your tracheostomy tube. You should have a checklist with you reviewing this information. You should also have a contact list with your healthcare provider's office number, the supply company for your materials, and any specific home care personnel you work with. If your tracheostomy tube becomes dislodged, replace it with the same size using the obturator to help. If this does not work, use your smaller emergency backup tube. Lubrication can help as well. If this does not work, please call an ambulance or come to the emergency department. If this happens within 7 days of your tracheostomy tube being performed, come to the emergency department regardless. It is important to be aware of signs of difficulty breathing, namely, difficulty getting air in or out of your tracheostomy tube, having to breathe excessively fast, and new noisy breathing suggesting there may be a blockage. The first step to take is to suction your tracheostomy tube to ensure it is not blocked. Following this, the inner cannula should be removed and checked to ensure there is no blockage. As a last resort, the whole tracheostomy tube can be removed and inspected, but if you have difficulty replacing the tube, this could potentially worsen your breathing. For patients with COPD or asthma, a breathing treatment can be administered through the tracheostomy tube, typically with a nebulizer. Some minor bleeding may occur from your tracheostomy tube or around it the first several days after surgery as the area heals. Patients with cancer, particularly of the voice box, can expect to cough up some blood related to the cancer as well. If you get a lung infection or other irritation, you may see some bleeding as well. While there are many reasons to have bleeding from a tracheostomy tube, one of the more common and preventable reasons is trauma related to suctioning. Any higher volume or persistent bleeding is considered an emergency, and patients should come to the hospital for evaluation. Sometimes the area around the tracheostomy tube or the stoma itself can become infected or start to have poor wound healing. Infections are often signaled by the presence of foul-smelling secretions. Granulation tissue is pink-red healing tissue that can occur at the stoma. It can lead to bleeding or difficulty with tracheostomy tube changes. This may require the involvement of a wound care nurse. If you have any concerns about the tracheostomy site, call your physician's office. We hope that the information contained in this video provides you with a foundation to build upon. You will have to gain hands-on experience of the care demonstrated in this video, both in the hospital and after you leave the hospital. If you have any questions about caring for your tracheostomy tube, reach out to your nurse, respiratory therapist, or physician who will be happy to help you.